Hi everyone, Angela Guanzini here with E4D University, and welcome to your Chairside chat for this week. Scheduling scenarios. So, how we can increase our profitability by becoming more productive through proficient scheduling. So, this week at the Business of Dentistry, this is the lecture that Dr. Gary Kay and myself gave. And, I look back to when I was dental assisting and before I became a CDD, and, this is kind of the thought that was in my mind. How could I be more helpful? So, for those of you dental assistants out there that are wanting to do more, and maybe, doctor, you're not quite yet ready to delegate to your assistant, I'm going to encourage you to take a look at this webinar and really think about how you're scheduling. Doctors, really, we want you to be anesthetizing and prepping and delegating everything else to your assistants. And I know there's a bit of a learning curve. I mean, that's absolutely just the way it goes. But when you work as a team, and doctor's the pilot and your assistant's the co-pilot, that's when the learning curve really goes away and you now have mastered that confidence curve. Because at the end of the day, the assistants, me as an assistant, I just want to make sure that I nail that margin and that I'm confident in my design. But I really couldn't be confident without my doctor taking the time to sit down with me and spend time showing me the way that he wanted his embrasures. And he or she, I worked for a male doctor, and so that's why I always say he, but he or she. So if your doctor sits down with you, if you sit down with your assistant and you show them marginal ridges, the way embrasures should look, functional cusps. Have you ever heard of no bolin occlusion? There's no buccal upper cusp that's functional. There's no lower lingual cusp that's functional. So think about those kind of things. Show cusp alignment. Spend a couple hours or spend a week working with your assistant through scanning and through designing, and I promise you it'll come back twofold, because now this is what your assistant's going to do. Instead of you doing the scanning, you doing the designing, and having your assistant simply put the block into the mill, we want the assistants being able to do everything. And this is how you can make that happen. So today what I'm going to talk about is crawl, walk, run. How to effectively and efficiently integrate CAD/CAM technology into your schedule. So crawling. What does crawling look like? Well, when you're crawling, that means, you're probably a pretty new user. And what we're going to do is we're going to recommend that you schedule 3 hours for that same visit appointment. Now, doctors, I know you're thinking 3 hours. She just said that we're going to increase our productivity. How is that going to increase my production if I'm spending 3 hours? Well, look underneath crawl. It says 1.5 hour doctor time. That's exactly what generally we're scheduling when we have a crown visit for a single unit posterior crown. We're scheduling an hour to anesthetize and prep and a half an hour for the patient to come back to see 2 weeks later. So now that hour and a half is just in one visit. But we want to under-promise, yes, and over-deliver. So we're going to tell our patients 3 hours so that they expect to be there for that full time. You want to make sure that you talk to your patients and let them know they're not going to be open for 3 hours, but that while they're there, they can bring work with them, bring their iPad, watch a movie, they can run an errand. Because doctors, where you're going to be and where the patient's going to be in the chair is right here. So that first hour, now this is, again, crawling. And doctors, if you haven't delegated to your assistants, this is the way that you should be scheduling in the beginning. This could be a half a dozen restorations. This could be a dozen restorations. It's all in the time that you spend teaching your assistant the design and teaching them how the teeth should look. So that first half an hour is anesthesia and prep. The second half an hour is tissue management, scanning in, and marking the margin. After that's done, then it's the design, the mill, and the try-in, meaning you're going to have a half an hour to design. Now that is a very long time. I understand that, but guess what? As an assistant, I'm not as efficient yet in this crawl phase. Now the mill and the try-in means I'm going to get that restoration out of the mill and I'm going to try it in. And I'm talking about EMAX here, just so you know, because it's the most popular material. So I'm going to be referring to single unit posterior using EMAX when I'm talking in these scheduling scenarios. So I'm trying it in the blue phase. That means as an assistant, I'm trying it in, I'm testing the contacts, and I'm having the patient lightly tap on the occlusal paper, taking the restoration out of the mouth and adjusting that occlusion. Characterizing and crystallizing. So obviously EMAX needs to go in the oven. Now there's also a new EMAX speed spray setting that cuts the crystallization process down to 15 minutes. However, you still have to spend the time to characterize it and to let it cool. So, this is a recipe. This all comes down to the under promise and over deliver. If I have a little extra time and I get my patient out sooner, bonus. That last half an hour, then doctor's back to seat the restoration. Now, assistants, we should have that restoration ready to go. Have that object fix cleaned up from the inside, have the restoration, hydrofluoric acid etched, ready for all the try-in. Now, this is what it's going to look like on a schedule. Okay, now I just scheduled in the morning, but I want you to kind of, when you're looking at this schedule, focus on, I'm going to put the little black box around here. This is one patient. Okay, this is one patient in the crawl phase. So 3 hours, 8 to 11. The green represents doctor time. If you notice, if you're looking at from 8 to noon, there is green every single minute, meaning doctor is scheduled for production all 4 hours of the morning. Assistants are delegated into the red and the blue. And obviously the pink now represents my hygiene appointment. So doctor's with in chair number 1 for that first hour. Now assistant number 2, that's in operatory 2, is what is she doing for that first hour from 8 to 9, he or she? They are working on next day restorations. They're possibly doing some design while doctor and assistant number 1 are anesthetizing and prepping. And then during that next half an hour, milling out restorations, characterizing and firing them. That's what this assistant could be doing during that time. Now, where the red assistants available now working on the design, the milling, and the firing, doctor's now working in operatory number 2 with assistant number 2. Spending that hour anesthetizing, prepping, designing, tissue management, all of that, just like we looked at with the pie graph. Now, front desk staff can see now where exactly they could schedule an emergency patient because red assistant number 1 is available while the restoration is milling and while the restoration is firing. Doctor's also available to maybe do some palliative treatment there in an overflow chair. So now that the assistant blue is designing, milling, and firing, doctor's back in operatory 1 because he's delivered the restoration, delivered the crown, and is now anesthetizing and doing restorative care on the next patient. So this is how that workflow should go. And it's so important that front desk and assistant and doctor all communicate when and where people are available to schedule emergency patients when necessary. Okay, so this is crawling. 2 full coverage crowns can be done like this and a whole nother hour of restorative care. Okay, this is crawling. Now let's take a look at what it looks like when we're walking. Walking means now, my confidence curve is up. My doctor spent some time with me, so now doctor doesn't need to be with me for an hour and a half. Now, look at the appointment time. We're down to 2.5 hours. Again, we're talking EMAX, and this is for integrating stress-free. So where is doctor? Well, doctor's anesthetizing and prepping, and doctor's at the end to prepare and seat. Because now, as pilot and co-pilot, doctors taught me exactly where, how his margins are, how to scan properly. Tissue management's under control. I've marked my margin. Okay, so now look at the times, how it's broken down. You don't have a half an hour to do that anymore. You have 20 minutes. You don't have a half an hour anymore to design. You have 20 minutes. You don't have a half an hour anymore to mill and try in. You have 20 minutes. Okay, that's where that 30 minutes dropped off because now you're more proficient as an assistant, as a hopefully CDD, and we'll talk about that at the end, a chairside dental designer. So that's where we shaved out that 30 minutes through the proficiency, which is now, yes, increased productivity. Doctor time is down to 1 hour, which means now doctor's more productive because he's not having that wasted half an hour of no production for the seat with that second visit. Here's what it looks like on the schedule. So patient number 1 comes in at 8. Now we've, again, EMAX, 2.5 hours. If you're not doing EMAX, you take off a half an hour because you don't need that crystallization time, the cooling time, all of that. Okay, so this is just a recipe. I want you to remember this. You've got to tweak things to how long it takes you, but you must time yourself. Okay, so please absolutely time yourself. Get a kitchen timer. That's what I did. Now I'm going to jump back here quickly. When you're looking at this pie, okay, 20 minutes scanning, tissue management, margin marking, 20 minutes design. 20 minutes in design is a lot, but still, we're walking. So look at this pie, write these numbers down, and then actually time yourself. Time yourself and see, is this how much time I'm actually spending doing this? So here's patient number 1, patient number 2, patient number 3. All, again, doctor time. The green represents doctor time, meaning there is not one area in this 4 hours where the doctor cannot be productive, working with 2 assistants and 2 operatories. So red assistant, when red assistant's not available, That's when the Blue Assistant can help with the emergency exams in Op 3. When Blue Assistant isn't available, then Red Assistant is working with doctor delivering the crown. Okay, so this is where, again, front desk staff kind of know that the assistant's going to be designing. They're not going to be able to take that PA over with the emergency patient. But however, doctor's available because assistant's doing everything else. And in Op 2, again, in that morning from 8 to 9 o'clock, that's where assistant number 2 can be working on those next day restorations. All right, so we've cut it down to 2.5. We're more proficient. Doctor time has been cut down to 1 hour. Now this is what running looks like. So when we're running, we have now cut our appointment time down to 2 hours, meaning telling our patients it's 2 hours. I want you to see where time is now cut back again. So, where's my doctor? My doctor is always anesthetizing, prepping, and coming back to seat. We have now cut down doctor time from 1.5 hours to 45 minutes, which means I have doubled the production that my doctor can make. So instead of him spending 1.5 hours on one patient, he's now spending 45 minutes, which increases your production chair time. Okay, because doctor can be out doing more restorative care. This is what the beauty is of delegating to your dental assistants. And dental assistants, I'm encouraging you, we're going to talk about this, you need to become a CDD. You know, this is where it's at. This is the next generation of dental assisting. E4D has changed the role of the dental assistant in the practice. We are now producers. We are now increasing production. Okay, so let's take a look at this, broken down into the pie. 30 minutes for anesthesia and prep. 20 minutes to take care of your tissue, scan, and get your margin marked. We've now dropped our design time into 10 minutes. If we're spending more than 10 minutes designing, something wasn't right with the prep or with our tissue management. Okay, end of story. That's what it has to do with. Now milling, 15 minutes to mill, we're saying on average, and then go ahead and do the try-in. Spend about 5 minutes doing that. Get it in and get it characterized and then crystallized. So that should take about 15-20 minutes, letting it cool. And then have it ready, hydrofluoric acid etch. Doctor comes in, we're ready to seat. Okay, so there's our time in our pie. This is what it's going to look like on the schedule. So on the schedule, this is where you're going to have your roller skates on. Now I understand that we're not always going to have this many patients in this booked of a morning, but I want you to know the possibilities. And with proper scheduling and the proficiency is going to increase the productivity. So here we go. Patient number 1, 8 o'clock to 10 o'clock. So doctor's the green time. Remember that. Doctor's in there for that first half an hour and the last 10 to 15 minutes. Chair number 2. Now, starting crown number 2. Okay? Or other restorative care, whichever works. But if you see, if he's doing that first half an hour, now red assistant is going to be now doing this next patient. Okay, so you just saw a patient in chair number 3 show up. So now that's red assistant helping doctor. Patient number 4. Now red assistant's back over here seating with doctor and starting our next preparation. Patient number 5, back with blue assistant, doing more restorative care. Now all of this can be tweaked. Obviously, if you're doing multiple units, if you're doing a side-by-side case, you're going to have to increase your scheduling time probably by about 45 minutes per additional prep. And that's because of prep time, design time, and meal time. So you have to take all that into consideration when you're doing an additional preparation and not just single unit posterior. So yes, I understand that this is definitely high-paced. We still have hygiene exams to do, but it is absolutely possible as long as all the team's working together and everybody knows where everybody is and helping each other out. So red assistant and blue assistant, talk back and forth all the time. Hey, you know what? I'm still over here with doctor, and we're still seating that crown. Could you go ahead and get my patient seated? Or could you go ahead and get that restoration out of the milling unit and get it characterized and into the oven? So it's all about that communication with your team. So the CDD program. If you haven't already signed up for the CAD/CAM Dental Designer program, I can't tell you enough how important this is. And truly, technology is, this is where things are going. This is where things are heading. And right now, if you're in a practice that has an E4D, consider yourself lucky. Okay, only 10% of the dentists in the United States of America have adopted CAD/CAM technology. And I think that assistants that are in a practice like that should really embrace it because you know what? This is going to make you more marketable. This makes you more valuable because now you're a producer in the practice. So if you haven't already registered for the E4D CAD/CAM Dental Designer Program, I want you to go to e4d.com. And I want you to log in using your username and your password under the resources and scroll down and sign up for the CDD program. It is a self-paced program. It can take anywhere from 3 months to a year, depending on how much you're working at it. But once you're that CDD, what you've done now is you're recognized by the ADA, okay, the American Dental Association. After your name, RDA is going to be CDD. And what this does is it brings value to you and to your practice. Because now when you're sitting chairside and that patient's in the chair and they say to you, well, aren't you just the assistant? Shouldn't the doctor be doing that? You say, actually, no. You know what? I'm not just an assistant. I'm actually a CAD/CAM dental designer, and I've gone, above and beyond and taken extra training to learn how to do this. And this, let me tell you, the patients are going to be amazed, and they're going to want to sit and watch you and talk to you, and you're going to be able to speak intelligently on function because doctors spent the time as your pilot to teach his co-pilot exactly how to fly. Okay, so this is a team effort. The front desk staff, we know this. So everybody working together and the assistant going above and beyond to get that CDD, and the doctor then learning to trust and delegate, and that only comes through the doctor and the assistant working together. My doctor and I went back to D4D and we took every single advanced education course they had to offer together. And what that did was allowed my doctor to see how I performed amongst other dental designers, amongst dentists. And that's when he said, gee, you know what? You really know what you're doing. And I said, yes, I do. Please let me do this. And you know what? He never looked back. It was from then forward that he allowed and to delegate it to me. And you know what? He had time then to go grab his coffee and go check his stocks or, make some phone calls, check some emails, because I then was embracing the technology. And I then became a producer in the practice. So I'm going to encourage you to get that CDD. Assistants, doctors, I encourage you to encourage your assistants to go for that CDD and learn to work together and be that pilot co-pilot team, because that's really where you as a team are going to become more proficient, which is going to increase your productivity twofold. So thank you for watching. It's always a pleasure to spend time with my fellow CAD/CAM adventurous, we'll say, because we're only the 10% of the United States. So, let's just encourage other people through what we do, through that quality care that we're offering our patients. And you know what? I want to hear from you. So if you could give me more ideas on things that you want to hear at future Chairside chats, please email me at aguanzini@d4dtech.com. Or you can always call the corporate number 972-234-3880 and ask for Angela Guanzini in the Education Department. Thanks again for watching and happy scanning. Until next week.